Hello everyone. In today's video we're going to be studying about the scalp and all of its major layers. So let's start with the basic definition of scalp. It is the soft tissue covering the cranial vault, also known as the skull. So this one right here, the scalp covers the skull or the cranial vault, and it has few layers. These are given in here diagrammatically, so I'm gonna take their names. The first one is the skin, the second one is connective tissue, also known as the superficial fascia, so you can write both, and the third one is epicranial epineurosis, also known as deep fascia, the loose areolar tissue, and the last one is pericranium. So we're gonna talk about these layers individually now. So let's talk about the skin. It is thick and hairy, as you all know. It is the outermost layer and is thick and hairy. It is adherent to the epicranial epineurosis. This one right here. It is connected to this one. So it has a connective tissue layer in between. So we're gonna talk about it in the next. So the second one is superficial fascia, also known as the connective tissue. It is more fibrous and dense in the center. As you can see here, it has more vessels and nerves and is less dense or fibrous in the periphery, and it binds the skin to the epicranial epineurosis. This skin to the epicranial epineurosis, which I was talking about, provides passage of vessels and nerves to the skin. So the next one is epicranial epineurosis. This one is kind of important. It is freely movable on the cranial vault, and on the anterior side it has a muscle known as frontalis. It originates from the front and inserted on the external occipital, which is kind of right here, the green dot, and on the posterior of it has an occipitalis muscle, sorry, this one right here. It is inserted on the external occipital protuberance, and on each side of it is related to the superior temporal line. So I'm gonna show it right here. This one, gonna draw it. This one, it is the superior temporal line on each side. So now we're going to talk about the next layer, the fourth one, loose areolar tissue. On the interior it is related to the eyelids, and on the posterior it is related to the highest and superior nuchal lines, and on each side it is related to the superior temporal lines. So now we're going to talk about the last layer of the scalp, which is known as pericranium. It is loosely attached to the bones and firmly attached to their sulcus. This one, these the grooves between the bones. It is more tightly attached to it. As you can see, this one right here, not clearly shown in here, but yeah, it is attached. So now we're gonna talk about the blood supply of scalp. This it is given in a diagram here. So the blood supply of scalp is divided into two parts. Like some arteries supplies in the front of the auricle and some supplies the behind of the auricle. So the ones which supply in front of the auricle are the supratrochlear artery and the supraorbital artery and the supratemporal artery. These arteries supplies the scalp from the front of the auricle, and the ones which supply the scalp from behind the auricle are the posterior auricular artery and the occipital artery. These are given in a diagram right in here. So now we're gonna talk about the venous supply. It is kind of same like every single artery, just rename, just replace the artery with the vein, and there is one exception like retromandibular vein. So yeah, if you wanna remember this one is easy. Just remember the arteries and put the veins. And let's talk about the nerve supply now. It is supplied by 10 nerves on each side. These are given right here. 5 enters the scalp in front of the auricle and 5 enters the scalp from the behind of the auricle. So this is all about the scalp, and now let's talk about the clinical anatomy of it. So the first is dangerous area of scalp. The layer of loose areolar tissue is also known as dangerous area of scalp because the emissary veins which opens here, these may transmit infection from the scalp to the cranial venous sinuses. So this can be highly fatal. So the next one is because of abundance of sebaceous gland, scalp is a common site of sebaceous cyst. So I guess I've covered the whole scalp. That's it.